Hello everyone, I am Dr. Saurabh Giri. I am an orthopedic surgeon with specialization in hip and knee surgery, which includes hip replacement, knee replacement, and knee arthroscopy. Many of time my patients ask me, Doctor, what is ACL, what is PCL, what are meniscus, and what are the other ligaments of knee. So in this video, I will try to answer it in a short. This is a model of a knee joint, which is formed by thigh bone, which is a femur, tibia, the low bone of the leg, okay, and these two bones form a knee joint. There are other bones also. One is a small bone of your lower leg, which is fibula, and a kneecap, which is called as patella, okay. So two main bones are femur, the thigh bone, and the leg bone, which is a tibia. So there are four important ligaments of the knee. One is ACL, another ACL, which is in the front of the knee, here ACL, then PCL, which is on the back of the knee, then LCL and MCL, LCL on the outer side and MCL on the inner side. So ACL stands for anterior cruciate ligament. It is on the anterior part, that means it is on the front of your knee, okay. Anterior cruciate, front means anterior, okay, anterior cruciate ligament. The function of the ACL is to prevent the anterior translation of tibia. That means it prevents the lower bone to move forward. If the ACL is damaged, in that case the anterior translation of the tibia, that means the tibia will move back and forth, okay. This will lead to rubbing of two bones to each other, and over the period of time you will develop arthritis of the knee. So ACL is the most important ligament. It prevents the forward movement of the tibia, okay. Then comes the PCL, which is on the back of the knee, posterior cruciate ligament. Posterior means back, okay. It also provides us the stability to the tibia and the femur, and it prevents posterior subluxation of the tibia. That means that the lower bone will not go posteriorly, not go behind, and then there will be no back and forth movement of the tibia, and thus avoiding any form of arthritis. There are two more ligaments. One is LCL, lateral collateral ligament, and the MCL, medial. Lateral is on the outer side, which provides the stability on the lateral side. MCL, medial collateral, which is on the medial side, provide the stability on the medial side. Then there are the two most important structures which are inside your knee. They are meniscus, medial meniscus, which is on these blue structures which you are able to visualize. These are meniscus. On medial side is medial meniscus, on the lateral side, that means outside, is a lateral meniscus. See, you can make out the thigh bone is curved, the femur is curved, it is like this. If you put it on down like this, the surface area of the contact is minimal, okay. What the meniscus do, they increases the surface area of contact between the femur and tibia, so that the load is not concentrated on one particular point. If the whole body weight is concentrated on the one particular point, that will lead to the arthritis. So the meniscus performs two important roles. One is increases the surface area of contact between the femur and tibia, as well as they act as a shock absorber for the knee. So these are the important structures of the knee. I hope you have understood the knee structure very well. So whenever you have a knee issue, either be it ACL tear or a meniscal tear, you should treat it as early as possible, so as to avoid the future development of arthritis.